Welcome to all my dears. Today we are going to discuss about the common presentation of a patient with IBS. Common presentation or what may be the PC of a patient expected in a case of IBS. And before that, let me try to explain regarding the pathophysiology of IBS. As the cause or the real cause of IBS, the exact pathophysiology of IBS is not yet clear. But the altered GIT motility, visceral hypersensitivity, and brain-gut axis, then post-infectious, etc. are the base pathophysiological changes that can be studied in cases of IBS patients. Genetics plays great important role in IBS. All these changes, that means altered GIT motility, visceral hypersensitivity, especially with dietary subjects, then psychological or brain-gut axis, then post-infections, along with the genetic peculiarity of our patient plays great important role to the continuation of the IBS condition. All these changes leads to increased number of cytokines or interleukin 6, etc. that will result in the production of signs and symptoms of inflammation. And let us see the symptom of our patient. Keep in your mind the signs and symptoms are vary from patient to patient, vary in its severity of symptoms, vary in duration of symptoms. So all these symptoms are vary from person to persons, and at the same time, to constitute the symptoms with IBS, the symptoms will last at least continuously for a period of 3 to 6 months and at least 3 days in a month. Depending on the quality or the nature or the intensity of the symptoms, the IBS can be vary from mild to moderate IBS, or it can be a mild to very severe form of IBS. But usually the IBS are not much severe in patients. In cases of severe to mild form of IBS, the symptoms may be mimicking of our peptic ulcer disorders, as bloating, especially aggravation after food, then nausea, then heartburn, then acid reflux, and easy feeling of fullness or loss of appetite. All these symptoms can be seen in our patient with a lycopodium, carbovage, then naxometer, trioflagellant remedies. This may be the symptom of our patient with IBS in mild to moderate case. And even though with all these symptoms, we can categorize we can create a mnemonics regarding the symptom of an IBS patient. The ABCD of patient, A, B, C, D. The ABCD of our patient can be narrated as: number one symptom is abdominal pain. And number two is bloating, that means gas or distension. So bloating or distension of abdomen, especially after food. Then altered bowel habits, that is, it may be presented as constipation, then diarrhea-like symptoms. So the ABCD of IBS may be as number one, abdominal pain, then bloating or distension, then constipation, then it may be alternate with the diarrhea. So alternate diarrhea or constipation with the abdominal pain and bloating with all the symptoms of acute gastritis can be the PC of our patient with IBS. Even though the symptoms of abdominal pain, the nature or the peculiarity of the abdominal pain is, it is very, very recurrent in nature. Abdominal pain which is recurrent abdominal pain with a very, and which is very, very intense pain, and the nature of the pain may be like that of a cramping pain or burping, then with the changes of bowel habits or constipation. So abdominal pain, recurrent abdominal pain with constipation or without constipation or with constipation and alternate diarrhea. All these symptoms may be like that of a case of Naxonica, then allos, then podophyllum, something like that, alternate constipation and diarrhea of Bryannia, opium. All this may be the symptom of our patient. And after having the defecation, patient will not feel any satisfaction. That means there might be a feeling of incomplete or a partial evacuation of the stool, and a cannot finish the sensation. Because of that, the patient wants again and again to go to latrine. So all these symptoms can be seen in a patient with IBS, because the being a patient with IBS, because of the IBS, it hampers the natural movement of the intestinal mucosal lining to move the digested food substances in the digestive tract in a very better manner. That is why our patient may having symptoms of constipation. And at the same time, in another set of patient, there is increased motility, and thereby the patient will have the symptom of diarrhea and urging. And the nature of abdominal pain, which is very diffuse abdominal pain without any radiation in the lower abdomen, and often the pain may be felt in the left lower quadrant of abdomen, and the presentation may be very acute or very constant, and it can be a dull ache-like also. And all these abdominal pains are usually or mostly aggravates after food, and all the pains or all the issues are relieved by defecation. So before defecation, the patient will feel more and more aggravation or more and more complaint about the GIT, and after defecation, the patient feel very relaxed. And so the abdominal pain we can correlate the abdominal pain with defecation, or the abdominal pain usually associated with changes in frequency of stool, or the abdominal pain usually associated with changes in the form or the appearance of stool. So it is the abdominal pain is usually related with the stool and related with the defecation and related with the consistency or the appearance of the stool. All these criteria may last for 3 months and the same may at least present in 3 days in a month to have a diagnosis of the possibility of irritable bowel syndrome. Because of all these symptoms, we can categorize the patients in 3 types. That means if our patient is having only or number one complaint, if it is a constipation, our patient's PC is mainly with the constipation. Constipation following one day our patient may having constipation and the next day he may having a normal stool. So constipation predominant type, and in another type diarrhea predominant. In such patients, early morning diarrhea of our Alus podophyllum, he immediately wants to, or he may jump into the toilet. He is having very great urge to. He is not having any control of. In such condition, our patient can be typed with the diarrhea predominant patient, and the diarrhea may be usually aggravation, especially in early morning hours and after eating. That is why he may feel satisfied only after going for 2 or 3 times, especially in the morning. That is why he feel very depressed and anxious about the issues. And in another case, one day our patient's PC may be constipation, and another day PC may be diarrhea. So if our patient is having a symptom of altered diarrhea and constipation, in such condition we can we can categorize our patient as a mixed IBS patient. So even in patients, the symptoms are varying from intensity, varying with duration, and varying with the severity. And the nature can be either a constipation predominant, or a diarrhea predominant, or a mixed IBS. And along with all these GIT issue, or due to the irritability of the bowels, because our patient is not having any control over the GIT feelings, automatically our patient may become very anxious about anxiety or a depression or a trouble in sleeping, and there may be chronic fatigue or a headache or unpleasant taste in mouth, especially in early morning hours, and muscle pains, especially in the lower back, or the palpitation and urgency or frequency to defecate. All these are the main or the common symptom of our patient with the IBS. And at the same time, we can see some symptoms along with some gynecological issues. If our patient is a female, the IBS may be having a very close relation with some gynecological issues like dysmenorrhea or dyspareunia, and urologic symptoms like dysuria and frequency, and musculoskeletal symptoms like symptoms of fibromyalgia, and psychological symptoms with anxiety or sexual abuse or psychological abuse. All these symptoms can be seen in, or most of the symptoms can be seen in our patient with the IBS. And next, about the complication. Usually the IBS may not cause any very severe complication, but at the same time it may, especially in very severe IBS, it can cause deep ulcers or infections, and more than that, very severe malnutrition and bowel obstructions are the main complication of our patient with the IBS. And next can be studied in another day. Thank you. Thank you for watching.